Does wearing a mask give people COVID-19?
Does wearing a mask give it? No.
Okay.
Not to my knowledge.
All right. Is COVID-19 a hoax?
No.
Can people cure themselves of COVID-19 by injecting themselves with disinfectant or bleach? I'm sorry?
No.
Dr. Anthony Fauci, the nation's top infectious disease expert, was on the Hill today, and House Democrats made sure to afford him the national platform the president has essentially taken away. In the hearing, he told the House Coronavirus Subcommittee that he does not believe a highly transmissible virus like coronavirus will, quote, disappear, despite the president's repeated assertions. When pressed by Maryland Congressman Jamie Raskin about the Trump administration's response to the pandemic, which has been, I think it's fair to say, the worst on planet Earth other than Brazil, here's how Dr. Fauci responded.
So what is the difference? Why are all of the other countries defeating the disease and we're not? Why do we not have a plan, a strategy for victory to win, to beat COVID-19?
Well, I believe I addressed that in not only my opening statement, but also in response to the question of the congressman. And that is that when you look at the comparison between Asia and Europe, as is shown by the chairman's poster up there, that when they shut down to the tune of about 95%, getting their baseline down to tens or hundreds of cases per day. So whereas when we did it, we got it down, but unfortunately, our baseline was 20,000 a day.
All right, so we're getting somewhere, but would you agree with me that the critical difference is either the presence or the absence of social cohesion and political leadership to actually develop a plan, execute it, and stick to it?
I think there was such a diversity of response in this country from different states that we really did not have a unified bringing everything down.
There you go. He got him to say it. Joining me now is that member, Congressman Jamie Raskin, Democrat of Maryland, a member of the Select Subcommittee on the coronavirus. Congressman, I thought the exchanges you had with Dr. Fauci and also some of the things that Redfield said today were interesting. What did you learn from today's hearing?
Well, I think that we're in remedial COVID-19 salvage mode at this point. I mean, we have to try to get whatever money into the system that we can for further testing and contact tracing. But it's hopeless with this administration and specifically this president in charge. We will not have a coordinated, comprehensive plan to defeat the disease. And that agonizes me. I think you could go back and look at your own tapes and you would see, and I knew nothing about epidemiology and disease and so on, but when this started, I started talking to everybody, and I ended up connecting with Donna Shalala, and we introduced a bill called the Reopen America Act, and it was all based on massive nationwide shutdown, and then states beginning to try to reopen by petitioning the Secretary of HHS to say, we want to reopen, here's our plan, a national scientific advisory panel to go over the plan, to help people come up with the best solution for them locally, and then for the federal government to pay for it and the federal government to coordinate the logistics instead of setting the states against each other in this ruthless dog-eat-dog competition that you recall from, the ventilators and the PPE and so on. And so it's been a nightmare from the beginning. And it was clear to me from today that they still have no plan. And their plan was, as they demonstrated at the beginning of the hearing, is to blame China, which is not only absurd, but ineffectual because Donald Trump praised China's performance 37 times in February, March, and April. And I've submitted them all of the documents to demonstrate that Trump was their biggest defender. Now they decide that's their best hand to play, is to try to blame China for it. But obviously, blaming other governments, blaming China is not a plan. And so I think we should try again. We should at least demand and insist upon this money that we've got in the HEROES Act to get through. It's just a matter of common decency now because we're talking about losing our own people, but the Republicans doubled down. Like, one of our colleagues this week fell sick, Louis Gohmert, and he is himself sick and he's blaming it on the mask. He says, the problem is, I think I wore a mask the last couple of days. He was trying to blame it on the fact that we were insisting that people wear masks. Herman Cain died after going to the Tulsa, Oklahoma rally with Donald Trump. And he died, and none of the Republicans mentioned it today. It took Democrats to mention it. I think it was Maxine Waters who brought it up first at the coronavirus committee hearing. They're just letting these people go. It's like a policy of mass human sacrifice.
one of the issues that came up today that I have been focused on, and I don't know what to make of it, is this data question. And it may seem esoteric, it may seem weedsy, but it's really important. There's three kinds of data we have. We have cases, hospitalizations, and deaths, along with positivity rate. And of those three, hospitalizations are the most concrete data that we have, right? Because we know that we're missing a lot of fatalities from COVID, that we see that in the excess death data. We know that cases are a product of testing. We might be missing cases. But you should be able to know, more or less, pretty exactly who's in a hospital for COVID anywhere. And it's a really important metric. And the White House has moved that data from the CDC, which has kept that data and collated that data for decades, over to HHS with a new contract, and it seems like it's kind of been a disaster. What is going on there?
Well, it's very simple. When Donald Trump sees bad news and facts contrary to his worldview, they don't try to change their worldview or incorporate the new facts. They try to extinguish the facts. I mean, if Mary Trump, his niece, is writing a book to tell the story about how he ended up the most dangerous and pathological man on earth, go and sue and try to get the book stopped. Throw Michael Cohen in prison again to stop him from writing his book. And if they don't like the fact that hospitalizations are out of control in Florida and Texas, and here I paused to take on my friend Jim Jordan again, he kept saying, well, the real test is whether the hospitals are overrun and the hospitals are fine. This was his big refrain 2 months ago. The hospitals are overrun again. The ICUs are packed to the gills. Now he doesn't mention that. Now he's off talking about protests. But I digress because he's getting under my skin, Chris. But, in any event, they're just trying to shut out the news. That's why they're saying, we don't want hospitalizations being reported by the states anymore to the Centers for Disease Control. Report them to us at HHS. We think we've got a little more control over that situation, and we'll be able to translate it. Look what Governor Ron DeSantis did in Florida. He fired the woman who wanted to do an honest accounting and reporting of the cases and the hospitalizations there. And so it's a whole GOP strategy. It's not one deranged person anymore.
Congressman Jamie Raskin, who is on that special subcommittee of coronavirus oversight, represents District of Maryland. Thank you very much.
Thank you, Chris.